High blood pressure affects around 40% of the adult population globally. Hypertension is a major risk factor for heart attack, stroke, heart failure, atrial fibrillation, peripheral arterial disease, vision loss, chronic kidney disease, and dementia. About 90 to 95% of the hypertension are due to lifestyle factors only. The remaining 5 to 10% of cases are due to an identifiable cause. Changes in the body composition, such as high fat mass to lean mass ratio, high omega 6 to 3 fatty acid ratio, high sodium to potassium ratio, and low magnesium level in the body due to lifestyle factors are the primary reason for increasing incidence of hypertension. The goal of cell activation treatment is to correct the root cause of hypertension by correcting the body composition at cellular level. With the cell activation treatment, along with the blood pressure correction, other associated lifestyle diseases like diabetes, dyslipidemia, obesity, fatty liver, arthritis, etc. can also be corrected with the same course of treatment. Why heart and blood vessels get sick? Cardiovascular diseases are the leading cause of death globally. Heart attack and stroke account for 80% of the CVD deaths in males and 75% of cardiovascular deaths in female. Other cardiovascular diseases include hypertensive heart disease, rheumatic heart disease, cardiomyopathy, arrhythmia, congenital heart disease, valvular heart disease, carditis, aortic aneurysms, peripheral artery disease, thromboembolic disease, and venous thrombosis. 90% of the CVDs are due to lifestyle factors and are preventable or even reversible to a great extent by lifestyle correction. Many congenital heart diseases can be prevented by proper planning before conception and lifestyle corrections, including correction of nutritional deficiency before pregnancy and by following a balanced diet during pregnancy and lactation. Malnutrition, including deficiency or excess of one or more nutrients during development of the embryo or exposure to toxins or infections, are the major cause of congenital disease, including the congenital heart disease. Metabolic syndrome is a precursor of heart disease, starting with obesity, hypertension, dyslipidemia, and diabetes, leading to atherosclerosis, thrombosis, heart attack, or stroke. Preventing or correcting obesity and balancing the lean mass, that is the muscle and bone mass, to fat mass is a key to the prevention of cardiovascular diseases. When we get a cut or wound, blood clots to help stop the bleeding. After bleeding has stopped and healing has occurred, the body should break down and remove the clots. Sometimes blood clots form too easily or do not dissolve properly and travel through the blood, limiting or blocking the blood flow. This is called excessive blood clotting or hypercoagulation, and this clot can block circulation in any part of the body, leading to serious health emergencies. Seriousness depends on the area and extent of tissue affected by the block, leading to lack of blood circulation and oxygen supply. There are many identified risk factors for increasing clot formation, including obesity, smoking, alcohol abuse, hypertension, excess cholesterol, triglyceride in the blood, etc. If a person notices that there is a very little bleeding with a cut or wound, it is safer to suspect excess clot formation, possibly leading to major health hazards, and confirm with further investigations. This is because internal clots can cause a range of dangerous conditions. What is a heart attack? A blood clot in a coronary artery can lead to heart attack. A heart attack occurs if blood flow to a section of heart muscles get blocked. If blood flow isn't restored quickly, the section of heart muscles become damaged from lack of oxygen and begins to die. If the block occurs in a small vessel, it may not produce any symptoms and called silent attack and is common in diabetic patients. If the block occurs in a major vessel, that lead to chest pain, fainting, etc., or a sudden cardiac arrest leading to death. Sometimes it may cause severe or long-lasting problems such as heart failure or arrhythmias. What is a stroke? A stroke can occur if a blood clot blocks blood flow to a part of the brain. If the blood flow is cut off for more than few minutes, the cells in the affected area get damaged. This impairs the part of the body that the brain cells control. A stroke can cause lasting brain damage, long-term disability, paralysis, or death. Can other body parts get affected by blood clots? Blood clots can create blocks in other body parts like lungs, intestine, kidney, etc. A blood clot in the kidney can lead to kidney failure, where kidney can no longer remove fluids and waste from the body. What is deep vein thrombosis and pulmonary thrombosis? A blood clot in a vein in the arm or leg can cause pain, swelling, redness, or increased warmth in the affected limb, called deep vein thrombosis. Such clots can break off, travel to the lungs, and cause pulmonary embolism, a serious condition that can damage the lungs, leading to the breathlessness and even sudden death. What is atherosclerosis? Atherosclerosis is a condition in which there is inflammation in the blood vessel wall with accumulation of inflammatory cells under the mucous membrane, leading to narrowing of the blood vessels. Sometimes they break off, leading to bleeding in the blood vessels, clot formation, and blocking of blood flow into the area. Typically, atherosclerosis begins in childhood as a thin layer of white yellowish streak within the inner layer of the artery walls, an accumulation of white blood cells, mostly monocytes or macrophages, and progresses from then on. The symptoms of this condition are rarely exhibited in children. This is why early screening of children for cardiovascular disease and lifestyle correction is best for preventing or reversing disease progression. Coronary artery disease is more prevalent in men than women before menopause. Atherosclerosis of the cerebral arteries and stroke affect both sexes equally. Narrowing of coronary arteries, which are responsible for bringing oxygenated blood to the heart muscles, can produce symptoms such as chest pain or angina, shortness of breath, sweating, nausea, dizziness, lightheadedness, breathlessness, and palpitation. Abnormal heart rhythms called arrhythmias are another consequence of this condition. Carotid arteries supply blood to the brain and neck. Marked narrowing of the carotid arteries can present with the symptoms such as a feeling of weakness, not being able to think straight, difficulty in speaking, becoming dizzy, and difficulty in walking or standing up straight, blurred vision, numbness of the face, arms, and legs, severe headache, and losing consciousness. This narrowing or closure of arteries going to the brain can occur in small terminal vessels, also leading to the death of cells of the affected tissue, leading to cognitive deficit. Peripheral arteries, which supply blood to the legs, arms, and pelvis, also can get affected by plaque formation and narrowing of vessel. Symptoms or the narrowing are numbness in the arms or legs as well as pain. Another significant location for plaque formation is the renal arteries, which supply blood to the kidney. Plaque occurring and accumulation leads to decreased kidney blood flow, hypertension, and chronic kidney failure. It is most important to remember that such narrowing of arteries are typically asymptomatic until late stages. Atherosclerotic lesions or the atherosclerotic plaque are separated into two broad categories, stable and unstable, also called vulnerable. The pathophysiology of atherosclerotic lesions is very complicated, but generally stable atherosclerotic plaques, which tend to be asymptomatic, are rich in extracellular matrix and smooth muscle cells. On the other hand, unstable plaques are rich in macrophages and foam cells, and the extracellular matrix separating the lesion from the arterial lumen is usually weak and prone to rupture. Rupture of the fibrous cap exposes the thrombogenic material such as collagen to the circulation and eventually induce thrombus formation in the lumen. Upon formation, intraluminal thrombus can occlude arteries outright, that is, the coronary occlusion. But more often, they detach, move into the circulation, and eventually occlude smaller downstream branches, causing thromboembolism. Apart from thromboembolism, chronically expanding atherosclerotic lesions can cause complete closure of the lumen. Chronically expanding lesions are often asymptomatic until the lumen stenosis is so severe, usually over 80%, that blood supplied to the downstream tissues is insufficient, resulting in ischemia. These complications of advanced atherosclerosis are chronic, slowly progressive, and cumulative. Most commonly, soft plaques suddenly rupture, causing the formation of a thrombus that will rapidly slow or stop blood flow, leading to the death of the tissue fed by the artery in the proximity, approximately 5 minutes. This event is called an infarction, leading to a heart attack or stroke. This brings us to the importance of keeping our blood vessels healthy and what is possible as an individual to prevent and reverse developments that can result in serious health hazards which originate in such vessels. What is the role of angiogram, angioplasty, and bypass surgery? Angiogram is a common diagnostic test done before angioplasty or bypass surgery. This is done to find out the location and extent of vessel narrowing blocked due to atherosclerosis. In angioplasty, the narrowed vessel is dilated using a balloon with or without a stent. In bypass surgery, the narrowed A blocked part of the vessel is bypassed by a graft, a vessel taken from some other part of the body. All these procedures are invasive, including angiogram, may lead to serious complications, including damage to the artery in the arm or growing from the catheter, possibly affecting blood supply to the limb, heart attack, stroke, damage to the kidneys caused by the contrast dye, tissue damage caused by X-ray radiation if the procedure is prolonged, serious bleeding, and even death. Angioplasty or bypass surgery does not cure atherosclerosis. It will improve blood flow to the affected area for a limited time. In effect, we can buy time for lifestyle correction or reduce or reverse the progress of the disease. Atherosclerosis is a lifestyle disease and is to be treated with lifestyle corrections. If lifestyle correction is not done after surgical block removal, the atherosclerosis will progress further, leading to occurrence of heart attack, stroke, leading to disability or even death. The real solution for prevention of vascular accidents due to blood clots or atherosclerosis is lifestyle correction, not angioplasty or bypass surgery and lifelong medication. Bypass surgery for coronary artery disease is an open heart major surgery done with the help of a heart-lung machine in which functions of the heart and lung during the procedure is taken over by a machine. This surgery is inherently prone to many intraoperative and postoperative complications related to anesthesia, surgery, and heart-lung machine itself. Related to bypass surgery, angioplasty is a low-risk option actually, but there are unique and mainly potentially dangerous risks and complications associated with angioplasty also. The risk include embolization or the launching of debris into the bloodstream, arterial rupture from overinflation of a balloon catheter, or the use of an inappropriately large or stiff balloon, or the presence of a calcified target vessel, hematoma, or pseudoaneurysm formation at the access site, and radiation-induced injuries, that is burns mainly, from the X-rays used. Angioplasty provides a less durable treatment for atherosclerosis and is more prone for restenosis. What is the role of statins, blood thinners, and antihypertensives? Medication for atherosclerosis and associated vascular complications like heart attack and stroke include statin to lower cholesterol, antiplatelet medication like aspirin and clopidogrel to prevent clot formation, and a variety of antihypertensive medication to control blood pressure. Most of the blood thinners become effective by their blocking action in the metabolism of omega-6 pro-inflammatory eicosanoid pathway. These drugs simultaneously block the anti-inflammatory natural healing process of the body by their action on the omega-3 fatty acid derived anti-inflammatory eicosanoid pathway. So it is more scientific and safer to promote body's natural healing mechanism by balancing the omega-3 to 6 balance in the body rather than consume more omega-6 and then try to prevent its action using drugs which can lead to side effects. Most of the antihypertensive act by controlling the kidney's ability to increase sodium excretion or by reducing potassium excretion. So it is more scientific and safer to optimize the intake of sodium and potassium in food and control blood pressure rather than to promote disposal of sodium or preservation of potassium with drugs. Maintaining the sodium to potassium ratio around 1:2 to 1:3 in food and at cellular level will reduce the strain on the cells in keeping the sodium-potassium pump and neuronal signal transfer. What is dietary omega-3 fat and omega-3-6 ratio so important for cardiovascular health? The essential fatty acids omega-3 alpha linoleic acid and its derivatives are anti-inflammatory or healing in nature, and omega-6 linolenic acid and its derivatives are pro-inflammatory in nature. High omega-6 fat results in excessive inflammatory responses, and low omega-3 fat results in reduced anti-inflammatory or healing response, which is the causative factor behind aberrant clot formation and atherosclerosis associated with vascular damage, which results in heart attack and stroke. A large number of drugs currently used for heart disease, hypertension, stroke, inflammation, allergy, asthma, arthritis, acidity, glaucoma, cancer, symptomatic relief of pain, and fever act in the pathway of essential fatty acids, omega-6 linoleic acid and their metabolites, and trying to block it metabolically. What this means is that a lot of drugs used in the treatment of all these diseases are basically trying to correct the problems created by the functional imbalance of a pair of essential fatty acids, omega-3 and 6 fats, and their metabolites. This is how we realize the importance of the link between optimization of essential fatty acids and these diseases themselves. Human beings evolved on a diet with omega-3 to 6 essential fatty acids ratio around 1:1. Whereas in modern diet, the ratio has increased to 1:10 to 40. Modern diet is deficient in omega-3 fatty acids and has excessive amount of omega-6 fatty acids when compared with the diet on which humans evolved and the genetic patterns were established in the past. Inside the body, these two series of fatty acids, omega-6 and its metabolites, eicosanoids, and omega-3 and its metabolites, eicosanoids and deicosanoids, follow parallel pathways, continuously competing with each other for chemical conversion to various molecules inside and outside the cells. An extreme excess of omega-6 compared to extreme deficiency of omega-3 fatty acids is what all of us get from food now. This leads to the incorporation of a large quantity of omega-6 derivatives on the lipid bilayer and a decrease in the quantity of omega-3 derivatives in the lipid bilayer, leading to increased release of arachidonic acid, a pro-inflammatory omega-6 mediator. Any drug used to block the eicosanoids from pro-inflammatory arachidonic acid will block the anti-inflammatory eicosanoids production from omega-3 fatty acids, which is not desirable. These omega-3 and omega-6 group of eicosanoids and deicosanoids act through more than 20 signaling pathways which control bodily functions involving inflammation, cell growth, and central nervous system. These two group of molecules derived from essential omega-3 and 6 fat have a complex mechanism of action, continuously competing with each other for the production and action. So, a drug targeted to reduce inflammation of the heart and blood vessel may alter the balance in the central nervous system and producing serious side effects, or a drug targeted to act on joints for arthritis may produce serious side effects on the cardiovascular system. So it is scientific and logical to reduce the intake of omega-6 fat and increase the intake of omega-3 fat, and to bring the omega-3-6 balance to the optimal 1:1 ratio, rather than developing and using drugs to block omega-6 activity. Why dietary sodium and potassium balance so important for cardiovascular health? Hypertension is the most important risk factor for stroke and heart attack. DASH diet, the dietary approach to stop hypertension, recommends the potassium intake to be increased to around 4,500 milligram and sodium intake to below 1,500 milligram. Evolutionarily, as a terrestrial animal, human kidney has the capacity to retain sodium and can live with as low as around 500 milligram sodium per day. But our capacity to retain potassium is low. Conduction of electrical nerve impulse depends on active transport of sodium and potassium ions across the cell membrane with the help of sodium and potassium. Modern diet is high in sodium and low in potassium. Sodium intake has gone as high as about 7,500 milligram and potassium has gone down to 2,500 milligram, leading to a reversal of sodium-potassium ratio in the diet. This put a strain on the sodium-potassium pump at cell level. Sodium-potassium pump is very crucial for maintaining the cellular integrity. Around 20 to 40% of energy expenditure of a body at rest goes to maintaining the sodium-potassium pump at cellular level, which shows the importance of sodium and potassium and to have an optimal level of sodium and potassium in the diet. Optimizing the sodium and potassium will not only help to control the blood pressure, but to reduce the stress level and the associated hormonal and biochemical changes in the body too. How cell activation treatment helps in prevention and treatment of cardiovascular disease. Cardiovascular diseases are of lifestyle origin and can be preventable and reversible to a great extent if we are able to give an enabling environment to optimize lifestyle. High calorie diet with a high saturated fat, trans fat, omega-6, starch, sugar, sodium and low potassium, dietary fiber, magnesium, vitamin D and omega-3 fat along with a sedentary lifestyle and an increase in the fat mass in the body with the accumulation of omega-6 fat is the salient feature of modern lifestyle. This is the foundation on which most lifestyle diseases including hypertension, heart disease, stroke, heart attack, etc. are built. A derailment in the lifestyle leading to a derailment in the immune system functions is the root cause of diseases. Lifestyle affect our health through three major ways: imbalance in nutrition, physical activity, or as toxin entering the body. Cell activation treatment for health optimization is designed to give an enabling environment for the individual to optimize the lifestyle and thereby optimize the health in a natural way and keep all the body parameters physical and biochemical, optimal without the help of medication or surgical intervention. If you have symptoms like breathlessness, tiredness, and discomfort while climbing stairs, walking, running short distances, etc., it is the earliest symptom of atherosclerosis. Vascular narrowing due to developing plaque and the result in reduced blood circulation leading to reduced oxygen and nutrients to the cell. When the narrowing reaches around 80 to 90% in coronary arteries, chest pain may start with mild exertion. Pain in the leg while walking for short distances. Pain in the hands while doing moderate work. Numbness, burning at the extremities are the early symptoms of atherosclerosis in vessels supplying concerned body parts. If you feel any of the symptoms, it means your body is asking you to correct your lifestyle. Initial evaluation of the health status before starting the cell activation treatment for cardiovascular disease include a detailed biometric evaluation for assessing the fat mass percentage and its distribution. Physical checkup and investigations are carried out to assess nutritional status and functional status of the different organs, and plaque tests to assess atherosclerosis activity and the risk of heart attack and stroke. Investigations and diagnostic procedures which needs X-ray, radiopaque dye, etc., which has a harmful effect on body like angiogram, PET or CT scan, etc., are avoided as much as possible. The cell activation protocol is set considering the individual's specific health needs and goals. Optimal nutrition, stimulation and protection of blood vessel cells from toxins with optimized nutrient composition and oxyflex, a gentle activity pattern can prevent and treat cardiovascular diseases and associated premature death and disability. Low calorie, optimized nutrient food and oxyflex stimulation protocol enable the individual to reduce the weight with ease. High content of omega-3, the healing fat, and ensuring the optimal omega-3 to 6 fatty acid balance. The omega-3 to 6 ratio 1:1 strengthens the immune system, reduce inflammation, and promote healing of damaged blood vessels. Optimized nutrient salt ensures optimal level of sodium and potassium in the food and at cell level. This will optimize the electrolyte balance and promote smooth conduction of electrical signals in the nervous system and thereby reduce stress on sodium-potassium pump at cell level and reduce the strain on the kidney. It's very important to understand that microorganisms living in the body called microbiome can contribute to atherosclerosis by their action on the immune system, changes in the metabolism, processing of nutrients, and production of certain metabolites that can get into the blood circulation. High fiber, optimized nutrient food promotes the growth of healthy microbial flora. Optimized nutrient food focuses on optimizing nutrition and strengthening the immune system of the body by balancing anti-inflammatory omega-3 fatty acids derived eicosanoids and pro-inflammatory omega-6 fatty acid derived eicosanoids. They are the mediators of immune activity and help in controlling inflammation and disease progression in the cardiovascular system. Cell activation treatment will help to clear other comorbidities like diabetes 2, which are a welcome relief to an individual facing a cardiovascular change. The goal of cell activation treatment is not only to regain the health of the heart and blood vessels, but to optimize the health of all cells in the body. The benefit of optimal nutrition, stimulation, and protection from toxin is given to all cells in the body, and thereby the individual get relief from all lifestyle diseases including diabetes, arthritis, allergies, etc. Cell activation treatment helps the individual to reverse the accelerated metabolic aging and bring down the metabolic age below chronological age.